begin today. As Ramona introduced me, my name is Ashley Clouden. I am the coordinator of volunteer services over at Mount Sinai West, and I'm also co-lead of the BLACC ERG with Ramona. We are so excited to have a conversation today with our very own Wendy O'Brien. She has definitely left a mark on everyone who she encounters. She's a great woman that I personally look up to, and we are so thankful to have her with us today.
Absolutely. I
Yeah.
couldn't agree more. And so, yeah, and so we wanted to just give everyone a few more minutes, but we would really like to start the conversation with Wendy because we have so many gems and areas to really hit. And so, if that's okay with you, Ashley, I think we should just go ahead and start the conversation with Wendy.
I think so. Sounds good.
I think so too.
Yeah.
So again, we are so thrilled to have Wendy O'Brien, who is the Vice President and Chief Nursing Finance Officer for the Mount Sinai Health System. She was formerly the CNO here at Mount Sinai West. And a little bit of background on Wendy, having attended Clara Barton High School for Health Professionals in Brooklyn, New York. She began her career in 1981 at Kings County Hospital as a licensed practical nurse on the General Medical Surgical Unit. She subsequently attended Seton Hall University, where she obtained a Bachelor of Science in Biology in 1988 and Associates in Nursing from Elizabeth General Hospital School of Nursing. Facing challenges in translating clinical needs to budgeting practices, she attended graduate school where she completed her master's degree in business administration and health service administration from Nova Southeastern University in South Florida in 2002. Wendy, Miss O'Brien, has over 20 years of just experience in nursing leadership, starting as a nurse manager and a director of nursing in South Florida. Having moved to the US Virgin Island of St. Croix in 2006, for personal reasons, she was appointed and served as Vice President of Nursing and Chief Nursing Officer at the Governor Juan Lewis Hospital, where she served for 4 years.
On her return to the United States in 2010, Wendy held various positions in nursing. She became Director of Nursing Systems for then St. Luke's and Roosevelt Hospital, Director of Nursing at Roosevelt, and Director of Nursing Education for Roosevelt as well. In 2018, after holding the interim Chief Nursing Officer position on 2 separate occasions, she was appointed to the title of Vice President and Chief Nursing Officer of Mount Sinai West. Finally, in 2021, under the leadership of Beth Oliver, Chief Nurse Executive for the Mount Sinai Hospital System, she was promoted to her current role of Vice President and Chief Nursing Finance Officer for the Mount Sinai Hospital Health System. Ms. O'Brien is a member of the American College of Healthcare Executives and the American Nursing Association. She aspires to be recognized as someone who is committed to the delivery of compassionate and caring support to all in need. In 2021, she was awarded the annual Caribbean Life Impact Award for her dedication to nursing. Wendy, we are so happy to have you here with us today. Thank you so much.
Thank you, ladies. Thank you. It's an absolute pleasure to be with you and to be with our audience. And thank you so much for this opportunity. You guys make me sound so good on paper.
It's our pleasure.
But thank you for this opportunity to represent the Mount Sinai Hospital System, BLACC ERG, and just to chat with you and share a little bit about my life experiences. And how I came to where I am today. So, I appreciate the opportunity.
Well, we are so thrilled to have you. And of course, this wouldn't be a conversation unless we started off with a little bit of fun icebreaker. So do you want to share with us a fun or interesting fact many people do not know about you?
So, I have to say, and I think, part of this introduction will tell you that most of the times when people see me, they see me in a role of just being serious, being that, that very business oriented person that, is just very conservative. And one of the things I really want people to know is that most of the time I am not that person. I am, you know, I think what you don't realize is that, you know, I'm this like cut up type of person that, you know, I'm always laughing. Oh, I'm always the jokester when I'm with my family and friends. So it's a complete opposite from who I am, you know, at work. Um, and you know, I think that says a lot because that's not who I'm perceived to be. So that I think that's about the interesting side of me.
That's fun. It's a little nugget for yourself, right? And then you can
Yeah.
just show it when you're ready.
And then it also has a lot to do with, you know, upbringing and culture where, you know, you remember the words of your parents in the background that constantly say, oh, just remember you have to be professional, you know, there's certain things you can't say or do, you know, but then you allow yourself that freedom when you get home that you can be yourself. You can open up, you can laugh, you can have fun, you can dance. So dance like
Yeah,
no one's watching.
absolutely.
Well, now we know, Wendy.
Yeah, yeah, yeah. Now you know. Now you know.
So as we mentioned in your amazing introduction, it seems like you took a little bit of an indirect path to nursing. Can you tell us a little bit about your journey and share some insight on what you have learned along the way so far?
So you know, I think I find it interesting, or just fascinating that, you know, when we talk about, you know, journey and life and where we've ended up, that we sort of reflect on the past, you know, with the idea that our current state was either within our control or that we were aware of the path before us. Um, I don't know that any of that is true. I think life is in fact exactly that. It is a journey, and it's navigated based on, you know, the limitations that you have in culture, parental influence, your passions, whatever it is that you want to do, and just life in general. The excitement of growing up, the impact of friends and you know those both in your family and those outside of your family, and all of that together, it just shapes who you end up. I could describe myself, you know, as being an expat, right? A child that was born on the island of Trinidad, you know, brought up in a family maybe of lesser means, and having, you know, limited knowledge of just the vast opportunities that were available to me. But I really knew who I was as an individual, you know, from a long time. I always knew, even from very early on, that I was very curious, right? And I was headstrong. So in whatever situations that presented, I had to be that leader. I had to be, you know, in front of everything. And then I had the desire to get to know, or to understand, you know, what made things work. How did they click? So, you know, early on when I came to this country, and I went to elementary school here and I went to high school. But when I went to high school, as I mentioned, I went to Clara Barton High for health professions in Brooklyn. You know, the best students were the students in the nursing program. So I had to join them. You know, I had to be there. I wanted to see what nursing was all about. But nursing wasn't, you know, my first passion. I mean, I like to build things. I like to tear things apart to see what was going on. So, but I went into nursing, and, you know, I had my Caribbean mother behind me going, yes, that's the thing to do. You got to be a nurse. You know, they have this program, you have to do it. And I got immersed in nursing there. But when I left high school, although I had a scholarship to then Hunter College in Manhattan, my family moved to New Jersey, and I decided I was going to go to Seton Hall University. And when I got to Seton Hall, I stayed on the path of science, specifically biology. And biology and science allowed me to get into the detail and to feed my curious nature. So I really got involved, and I decided, well, you know, the most in, you know, influential program there was the pre-med program. So, that was me again, just getting into whatever was seen as, as being the leading program. And I loved biology. If you asked me today what I wanted to do with my life, I thought about being a histologist. I wanted to see what cells looked like and how they differentiated in the presence of disease, and other issues. But there was no raving reviews about histology. I didn't hear anyone saying, wow, I want to be that histologist. So then I said, okay, it's pre-med. And the program was a pre-med program. So for many years I had in my mind that I wanted to be a physician. Specifically, I wanted to be a surgeon. But unfortunately, life happened, right? And just me as an individual, and I can only speak for myself, and the challenges that I faced, with both my role in my family, being that curious teenager, being a student, being an employee, because I always worked and went to school. I was always in school, either studying nursing, and biology, or working. Once I got out of Clara Barton High School, I was an LPN. So I was always working as an LPN at that time. So I did both. And then my grades suffered. I attended University of Medicine and Dentistry for a summer program that they had. And I sat for my MCATs, but I didn't feel like my score, I knew that my score was not as competitive as it needed to be. And I knew little about navigating my way through med school. So, I took the advice of my mom then, who, always had my best interest at heart, but that Caribbean culture, oh, you should be a nurse, you got to be a nurse. And I went back into nursing after that. So, and I readjusted, but not because I regret anything in my life, because I do feel that nursing ultimately has afforded me the life that I've grown to love. I love what I do. I love my peers, both all of my clinical peers, my friends, physicians and nurses, and all of my coworkers. But nursing has allowed me to really be in touch with patients and people in their time of need. And I think it brought out a more compassionate side of me, that today really shapes who I am as a person. So, kind of a roundabout way of getting to a career. But I'm happy to be here today. And today I am most proud of being a nurse.
Yes, thank you so much. I learned so much about you just from that response, Wendy. Thank you so much for continuing to, you know, stay on this journey, stay on this journey of learning, of growing to find out what works for you, what you're interested in. And I think along the journey, like sometimes the things that we see can deeply affect us, but we have to like keep holding on and pushing forward. So that leads me into our next question. A part of this journey, we've all experienced COVID-19, right? COVID-19 was and continues to be unlike anything we have ever seen in our lifetime. It's affected us in so many areas that at some point it kind of overlaps in different parts of our lives, right? Do you think you can touch on some of the ways that this pandemic has affected you in an intersectional way? What, if any, changes have you made due to this impact?
Wow. Actually, I think all of us in healthcare and hospital work can talk to you ad nauseum about the impact of COVID on our lives. Admittedly, this rapid or fast-paced, ravaging, disease has really surpassed any experience I have had or thought I could foresee. And that's actually saying a lot, because it's been 40 years of healthcare. I can tell you, throughout those years, there has been no shortage of pain related to poor health outcomes, deaths, and other experiences that we all can tell you that we've seen. But this experience is unique because a lot has happened in what is a relatively short period of time, right? We're looking at 14 months of, you know, despair, of, you know, pain, and you see that in your work life, and you see it as it affects your home life, because we can all talk about the friends and families that have been impacted negatively by this virus. But one thing I can say is, you know, out of the negative, out of the dark cloud comes, you know, always comes a light, always comes an awareness. There's that silver lining, and that silver lining has been in the profession that I chose. I have never been so proud, as I said before, and so much aware of what nursing really is than I am today. I've always been aware of the bravery and the commitment of my profession, because I've said many years ago that nurses are like firemen and emergency responders, that they run in where most people run out, right? So when there's a disease process, the nurse and the healthcare worker goes into the room. We don't run out of the room. We go towards it. When someone is suffering, we go to them. When their behaviors are out of the ordinary and they're violent or they're abusive due to a health condition, mental or physical, we go to them. But what I have seen working in the hospital in COVID just multiplies that beyond what anyone could imagine. And I was there, I was involved with the AIDS epidemic in the early 80s. I was involved with the TB outbreaks. And then there was every other, you know, viral and bacterial issue of SARS and, you know, every other flu that came out. But there, you know, again, no words to express the respect and the pride I feel for my teammates, because I watched them care for thousands of patients on every given day. And when most people would run out of the room, I watched them don equipment, PPE equipment, and go in. I watched them comfort people as they were dying, even that they had to do that in the absence of family support and in the absence of a lot of other supports. I watched them sacrifice their family life to the service of healthcare. And that will always stay with me. The endless committed hours, the dedication, the care, the compassion for our community and each other, and just the fearless responses to emergencies. So for me, it's been, you know, sort of an awareness of the choices that I made early on, how they impact community, how they impact my overall life, and how I have adjusted, because now I look at life completely different because of this issue. I value life more. I value time with my family and friends more. I value my coworkers more. I value just the commitment and dedication shown by others. And I hope to always, you know, stop, as they say, cliches, and smell the roses and just enjoy those around me. I think, if anything, it's simplified my life so that I realize what's not important and what is of most importance. It's not the material things. It's actually the relationships, the people, those that we hold dear to us. It has simplified life, if I have to say that.
That's an outstanding response, Wendy. And if I may just go to the chat for a moment. Gentleman, I think you know of the name of Dr. Evan Flato, would like to make a comment. And he says, when nurses were afraid when we received our first COVID patient, Wendy put on PPE herself and went in the room to show the nurses how to care for him. So I think that that is an outstanding cornerstone of who you are and what you have contributed so far to this, not only this organization, but just to this community. And so that shows your resilience, and it speaks to everything that you have said previously, of who you are, what you believe in, and what you want to be able to give back in your career. And so that kind of leads us to our next question, which is ensuring equity and equitable opportunities have been a constant standard in your career. Can you talk about how recent events surrounding social justice has influenced you and your continued efforts in the creation of equitable opportunities and spaces within the Mount Sinai community?
Wow, hot topic. Hot topic,
For
Ramona.
nothing else, we bring conversation and dialogue.
Okay, so let me be candid. I have at times, and maybe too often, been angered by some of what is going on in our community, the violence. I've been pained. I struggle every day with my perspective on everything. The racially motivated violence and killings of Black and brown people that's hit the news of recent. I'm disappointed that people, who look like me have to face these types, or any people have to face, because I'm also keenly aware of everything in the news. So being the person that I am, when I hear of groups of people that suffer, and usually at the hands of other human beings, it breaks my heart, because to think that a human being could just look at another, and because of differences, all of which we made no choice of. I made absolutely no choice of the color of my skin, my appearance. I made no choice of, where I was born. So to be persecuted or abused for something that it's outside of your choice, just flow, it just baffles me. And it baffles me that of the degree of cruelty that we can impose on some entity that looks exactly like you, that breathes and walks and talks exactly like you. So I do have to say that I try to put all of that in the back of my mind. And as a Black woman, as a leader, I'm also increasingly mindful that we live in a society that looks at everything that we do, every decision, everything that we say, with this lens of scrutiny. Are you doing it because you're with that group? Are you doing it because you're a woman of color? You're Black and I'm white. Are you doing it because you're heavier and I'm thinner? Are you doing it because you have more than I have? Always with this degree of comparison, and always with
Right.
this exclusive type of behavior. But I'm mindful that everything I say and do can be judged, but I try to do it again from a position of knowing what I have experienced and what members of my family and others have experienced. And I try to interact with people in a way that allows them to express who they are, and allows me to express who I am, but allows us all to, abide by certain rules and expectations that we have in the workplace. And the expectation in healthcare is that you provide compassionate, quality care and service, right? We all made an agreement to be in this service industry. Many of us took an oath, to do no harm, to serve others. And my intent is always to support that, right? Are we doing what's best for the patient? Are we doing what's best for the family? Do we care, right? Are we interacting with them in a respectful way? And that is, it's not just to the patients and to the families, it's to the staff. It's to when they say, they're uncomfortable, when they say they're in pain, are we there to support? Are we there to provide? Are we there to listen? Are we there to understand? And I want to continue to do that. Without feeling that, oh, who's looking? What am I, am I being judged? Am I walking the line? Am I, should I do it because I'm a Black woman? Should I, should I do? And that's like a minority, quote unquote, in this society. I just want to do for others what feels right to me. Um, and I hope that when I do interact with all the decisions that I make, that I'm respected for my decisions, um, and that I'm perceived as being a person of, of compassion. Um, it's not an easy task. It's really self-preservation on one side, being a conformist on the other. It's a juggle every day. Um, yeah,
Yeah.
I don't know how else to say it.
Thank you so much for your honesty and transparency. Oftentimes, we don't get to experience that side of our leaders. So it's great to know that you have taken your experiences and your perceptions as a woman of color in this role of leadership to identify other people, what they might be dealing with. And that definitely speaks to the respect that we have for you. And for me personally, like, that's why you are now in the role that you are in. That because people see you. You're a transformative leader. Like you see the greatness in other people and just continue to give that in everything that you do, from going into the first into the room of the first COVID patient and showing people, showing our nursing staff how to take care of that patient. That's what a leader does. There's no one standing aside beside of you. It was you, and you were leading a whole pack. And thank you for considering everyone in that time, and just allowing them to be safe and continuing to care for others. And that leads me to our next question. At Mount Sinai West, we've known you as our chief nursing officer, and now you've soared to new heights as our system VP and chief nursing finance officer. Again, because you've taken all of your experiences and perceptions and just combine that into your work. Your transition has definitely given hope to young women of color like me, because we see that we too can ascend to new heights. Do you have any advice for young women looking to ascend in their careers?
Mm, lots.
Let
Can be very
me get my
opinionated at
notepad.
times.
Yeah, I was just thinking the
But
same thing.
but
I just hold that thought.
yeah, no. Actually, my advice is always, to think about your choices, right? Sort of choose wisely. Leadership is not, wow, the person that gets to boss people around um, and just reap the benefits of position and title, right? Leadership means being able to follow, uh, being able to bend and give in, um, and still come out intact, right? So part of the agility is in knowing that it's not about me. It's not always about my decisions, but it's about what is the best for, for the whole. Um, and knowing that, I think you look at me and you say, oh, system chief finance officer, there's a lot of pain that comes with growth, right? As a matter of fact, all growth is accompanied by pain, because you have to learn to be flexible. You have to learn to bend, and at times when you don't think that you want to, you should, because you learn from it. I know you and Ashley and Ramona and I spoke earlier about, just how do you get here in life, and what it all entails. But really, my advice to everyone is find a support system. Find that those joys. I talked about dancing and making jokes and just having a fun time with friends. Put that in, make sure that that is a part of your life that you work on as much as you work on your success. Um, and commit to those experiences with a degree of frequency that is the same as you would to your success, your climb. And then whatever you choose to do, jump in both feet, right? Don't be halfway in. I want to do it. I don't want to, no, jump in with both feet. A great mentor of mine once told me a long time ago. He said, I see you sipping life. He said, I want to see you take gulps of life. Go in and don't just sip it. Take a gulp. Take many gulps, right? But in everything, stay the course. You can't jump from one thing to another. You can't, and succeed. You can't be an expert at everything. Um, but you can focus, and be an expert in a few things. And that's what I did with healthcare and nursing. And I would apply that to any other career. Stay the course, be committed, um, and just remember, the success is not determined by titles. It is a lot to do with self-acceptance. Whatever title you have, you are a leader in that area, whatever role you play. um, and in everything, you have to be able to live with yourself, your decisions, your commitments. And if you're able to do that, then whatever level or work, position you are in life, you are truly successful because you have accepted your role, and you've given it your all, and you have found the joy in life. I'm always looking for the joy in life. I find it in many areas on many days. And then there's some days that are hard. There will always be days that are hard. They shape me, and they help me adjust because I only have to go through a painful situation once, hopefully never twice. If I do it 3 times, it's really shame on me. Um, so that is my advice to anyone in any career and any you know level in their life.
I'm just so happy we are recording this, because this is definitely going to be a resource that not just myself and Ashley will go back to, but I know that for anyone who wasn't able to join us live today, or even if they had, they'll be able to refer to this because that was just an expansive gem that was just shared as well as everything else. So I'm just so happy that we're recording this.
Yeah.
Kind of switching gears a little bit, it wouldn't be it wouldn't be us to not ask you at your level this question in regards to COVID, specifically with the vaccine. And although the COVID-19 vaccine is now available, there's still a lot of hesitancy around getting it in communities of color. What have conversations been like for you and the communities you serve? And what are some suggestions you provide for anyone else like us who are in healthcare who may be kind of approached with the same hesitancy type of conversations?
Wow. What a powerful topic.
Dialogue.
So I think everyone knows that, the conversations you have professionally, and sometimes the way you may phrase those conversations privately can be can be and should be different. But I get the opportunity, to talk to my friends, family, and others, about the crisis and the vaccine. And, I get all sorts of perspectives on this issue. My position is very simple. Try to keep things simple in my life. Yes, people of color have reason. They have reason to be concerned. Uh, the histories of experimentation with people of color, you can't erase that, nor do you want to. You want to always remember it, right? Unfortunately, you know, um, that business person and that black and white person that says, right now, the risk of death outweighs any benefit you can gain from abstention from this vaccine. So saying that, I'm not going to take it because I'm afraid someone's going to use, me as a guinea pig and an experiment on me. You can take that position, but you run the risk of dying. And I think to me, that's very straightforward. You weigh the risk. I would, I'm not going to lose my life for a decision based on, an issue, an element in history. Let me be candid. Anyone that has an intent to bring harm to you is one step ahead of you, right? They're ahead of you. You can't think, you don't even expect it if that is that individual's intent. Um, yes, you can try to protect yourself from certain risks if you know them. And again, for people of color, and I'm going to really be honest and say, literally, there's so many other things to be worried about. Structural racism addresses and deals, with poverty, right? Exposure to drugs and alcohol, lack of education. And unless we are willing to take a stance on those things and reduce the number of deaths associated with those issues, then this is not the issue of a vaccine is not the priority. I mean, we should start thinking, what am I doing to improve the education of my people? What am I doing to improve the health of my people? What are the reductions in the use of drugs and alcohol? What can I do to support those issues? And then we can also address, where we are with, accepting vaccinations and other things. But we have to really look at the data and the statistics of how many people lose their lives related to other social issues. Um, no, those are to me are pressing. Um, so that I think that's my position. It's benefits and risk always. And right now, uh, we've already seen how many people, 500 and what, 40,000 people gone. We can't afford to lose any more if we can prevent it. So take the vaccine.
Yes.
Duly noted from Chief Nursing Finance Officer.
Yes, thank you so much for sharing that, Wendy. And if anyone is interested in getting the vaccine, you can contact individuals at your site. They'll be willing to help you get a vaccine if you are open to getting one. I just want to take some eyes onto the chat, Wendy.
Right.
Our audience is really showing you some love here. We have Sean Lee that says self-acceptance. I love that. You cannot compare yourself to others. That really resonated with me as well, to the question that we'd asked. To your response was like, it takes like that self-love and self-appreciation. I legit was just having that conversation with myself today and yesterday that I need to put in as much work into my own things as I do to other people's work. Like I'm coming to work and doing all these great things. Okay, I need to have that same energy for myself when I go home and focusing on my work. So you definitely hit the nail with all of that to us.
Actually, if and I'm sorry to interrupt you, I think we don't put as much emphasis on protecting our mind as much as we do, our belongings maybe.
Yeah.
It's so important to protect your mind, right? To learn to love yourself, learn to appreciate, things that you have, protected from outside influences, and especially negative influences.
Mm-hmm.
So, that's a priority for me. That's my lifetime goal, to always protect my mind for what comes in. And then I'm assuming that what goes out after that would be even better.
Yes, you are just dropping gems today, Wendy. I'm beside myself.
Exactly. It speaks to really, as Ashley said, all of the wonderful comments we've received just in regards to your leadership and who you are, Wendy. I mean, we're reading something where it says, Wendy, you are an inspirational and transformational leader. Wendy, you are so thoughtful in your responses. We also got someone who said, I'm proud to know Wendy O'Brien has Trini roots.
Yes.
So there's that. there's a big one there too. Can't leave that out. And we get so many. Wendy is an inspirational leader, thoughtful, assertive, and compassionate. I mean, they're just going on and on.
Thank you all for all of the
and
wonderful
there are so many more.
And let me
So
say,
many.
Ramona, I have to interrupt, and I'm sorry again, but let me tell you, the team of healthcare workers, everyone from environmental services, food and nutrition, healthcare, that has taken care of me over the years, especially at, at West, my last stomping ground. Everyone in that hospital, EVS, food and nutrition, the AV guys, everyone took care of me. I have never felt so pampered in my life as to the relationships that I have with my coworkers, the numerous meals that have been provided, just the overall support. I am so thankful. Everyone, all the way up to the senior leadership team. You heard from Dr. Evan Flato, Tim Day, Tracy Breen, Jennifer Jaramaham, my co-CNOs, the care that has been provided. We talk about relationship-centered care. It is really in the relationships we have with everyone we touch. And I can tell you, I would go into that building without a second worry, if whether things are good or bad, because I know, and they have taken care of me in for illnesses. I mean, I fell once, and the team at West took care of me. And I've been there as a patient, and they took care of me. So I am so honored to have, an extended family and everyone, and healthcare and those that I work with. It really touches my heart. I could not have done anything without that team.
That is amazing, Wendy. We feel the same about you. Who knew?
Thank you.
Yes. Wendy, we actually have a question from Monica Katie. Hi, Monica. Monica says, as a Black woman and leader, I have dealt with the perception that I'm aggressive versus assertive. Oh, no. Do you have similar experiences? And how do you suggest Black women navigate through those experiences? Great question, Monica.
Yeah, great question, Monica. But let me tell you, and women in general, not just women of color, women in general seem always, when being assertive, it seems to take on a negative connotation. When men are being assertive, there's no question they're assertive. It's actually a pride. It's like, as a people, as a culture, we're changing. I think it's becoming more acceptable, and we're doing away with these stereotypes. Women are not any more assertive than men are. Black women are not any more assertive. I don't know. People could form whatever perception, but know in your heart that you're interacting with people respectfully first, right? And that that you're just in the things that you do and that you say. Check yourself, because I don't want to say that you're not assertive or you're not aggressive. Listen to the feedback of others, because I've been taught over the years to change some behaviors, and I accept that. I receive it and I accept it. So I'm not saying whether you are or you're not, but trust the people. Ask the people you can trust to give you the truth about who you are, not the people that just will tell you what you want to hear, but ask the people who will give you the honest truth of who you are. And there may be things you need to change, and then again, it's probably not. So I don't take one position or the other, but I know that historically, an aggressive woman is supposed to be a negative thing, but there's a lot you can't achieve if you're too timid. So
right.
Remember that.
Yeah.
So that leads us to another question that's in the chat. Where did you find your mentorship for your leadership transitions?
Oh my God. Sometimes I feel I found mentors that they found me. I was in South Florida and worked with now deceased Dr. Andrew Eagle. He worked me. I thought the man was out to torture me. I thought he hated me. He gave me an additional 4 hours of work after my workday was done, maybe sometimes 6 hours of work. And I thought he didn't like me, but in fact, he turned out to be my best mentor, my greatest mentor. He pushed me, and I learned from him that I could do it. It strengthened me. Over the years, people have come out of places I never expected. Or I have aligned or they have aligned with me when I was shocked. You have to be open and willing to receive feedback. And sometimes the person that pushes you the hardest cares for you the most. So just be willing to hear the truth. But I can thank, for every challenge that I've faced, and, every honest, statement that has been made. It's allowed me to grow. And I've found those mentors in all walks of life. I have found mentors in departments that had nothing to do with nursing and nursing leadership. So anyone that can help you grow in life is truly a mentor. Be open and willing to take advice.
Yes. Thank you so much for that. Yeah, mentorship is definitely useful when navigating your careers, especially when you're starting off, you don't know where to go. And sometimes just it happens organically. Sometimes you don't set out to say, hey, I'm going to look for a mentor. And sometimes they come finding you, like your experience was. Yeah. So that is great. Wendy, again, our panelists are showing you some love. Kathy Ann says she's always admired you from the Roosevelt days. Hi, Kathy Ann.
Hi, Kathy.
She says this is very inspirational and insightful.
Right. We received another one. I can't see exactly who it's from, but your insight and philosophy resonates with me and our healthcare workers. Such a treat to be a part of this session.
Thank you.
It's really amazing work. Really amazing work. And so we encourage anyone else who may be attending to please ask questions. As you can see, we have amazing resource in Wendy here, and she is really well ready and able to answer any questions. Yeah. But right now we do have one last question to ask Wendy before we let her go. And I'm not sure if Ashley would like to take that last question because it's just such a little hidden nugget.
Yeah. So do you have anything else that you would like to share with the audience? Any little gems or any pieces of advice that we may have missed? And also, I have one personal one.
Hey, let's hear it.
So like we've been through so much in 2020, right? I feel like most of us are focused on wellness, focused on self-love, and just really being there for ourselves, right? So with that in mind, do you have like a theme word for 2021? Like a word for the year that allows you to remain grounded, allows you to continue focusing on you and building you? Do you have like a word?
Yeah, so, it's funny. If I were to think of something off the top of my head, I would say mindfulness. Being aware of, what's around you. For example, today, beautiful sunny day outside, clear skies, right? Trees all in bloom. I mean, really, have we stopped to appreciate that? Whatever you have in your health today, whatever today brings you, have we stopped to appreciate? I used to tell my nurses, they are the elite amongst the elite. And I mean it, because when we think of ourselves and think that of billions of people on this earth, how fortunate we are. And I'm talking about everyone on this panel, everyone that's listening, that we picked and chose our meals today, that we woke up breathing and able to, interact today, physically able, mentally able. Yeah, we all have limitations, but we all have the basics of life, right? Food, shelter, clothing. Those that work at the hospital, or whatever degree, whatever you have, it doesn't have everyone, you can't measure it. There's always someone with more, there's always someone with less, but be appreciative and mindful of the good things in life. That's really what, I think about every day. So I try not to complain. Someone says, oh, there's nothing to complain about. I happen to be one of the most fortunate people I can imagine. Today, I could say I don't have a problem that I worry about. I eat, sleep, I have everything I need. And then I'm surrounded by a whole lot of love, a whole lot of wonderful people. Um, and I just keep meeting more people every day. So that's all, and I appreciate that. And whatever I have that I can share, I have to share it. That's my goal in life. Someone may just need a good word, a comforting, a smile. They may just need, just a joke. I'm good for that.
And it goes a long way.
As we've learned, you're good for jokes.
Yeah, so just mindfulness, and and just to know that someone's there for you. God, I started this thing when I was at West in the cafeteria. I used to call it Pay It Forward Fridays. When I went into the cafeteria, I would pay for someone's lunch that was standing behind me, and they always thought that was unusual. But if they only knew how many meals I received for free, they would think that I'm like behind, because Anita and her team, oh my God, they fed me like you can't imagine. All the coworkers who bought me traditional meals, Caribbean food, things I didn't expect. I would come back to my office, it would be full of food. My desk with little notes. I bought this for you. I got this cake. I cooked this. And all the West Indian people, yeah, to my Caribbean friends for all this stuff. And all the people who even I remember Lisa Webb had a garden, and I would come back to my office, and there would be like vegetables and peppers and stuff on my desk. Jill Frick in the ED at West, she has a whole farm. So it would not be unusual for me to have eggs, and Jill wanted to bring me a turkey, a raw turkey.
Wow.
So I benefited so much. So anything I can do to share with others, like I need to do that. So
That's amazing,
yeah.
Wendy.
Absolutely.
We have one more question from Sean Lee. Though there are many moving pieces to this, what is one thing you think should be prioritized towards a culture shift of normalizing more minority women in leadership and equal opportunity?
No, absolutely. Listen, the leadership of the organization has to reflect the community that it serves. We, as we have to see representatives in all aspects of what we do. An organization cannot truly succeed without recognizing all of its people. It has to happen at some point or the other, because even if there are those working for you, if they see time go by and that there's no representation for them, you're not going to have a committed employee, right? You're always going to be them and us. If you want committed employees, you have to have them represented in all aspects of the work that you do. Because anyone could get 40% out of an employee, but that's not the goal. The goal is to get 100%, to get as much as you can. And to do so, there has to be a degree of trust, a degree of respect. And if that's not there, you're not getting what you're paying for. You're paying, but I hear the comments behind the scenes all the time. Oh, they don't care, or once someone starts talking like that, you're not getting everything you can from them. If you want to get work, quality work from anyone, respect them and have them be represented in all walks of life, everything that you do.
Wendy, that was just a really amazing way to unbelievably close out this amazing session. I can't believe an hour has passed that quickly. Just all of the wisdom you shared with us, all of the great resources, all of the wonderful career tips, and we're still getting so many wonderful comments about you and who you are. in the chat. It's a really, really, this was just an amazing moment, an amazing space. So Ashley and I cannot thank you enough for taking time out of your completely busy day to come and have a conversation with us. As many people may know, if you know Wendy O'Brien from Mount Sinai West, she is the most approachable person. She will stop you in the cafeteria and ask you how your family is doing and ask how you're doing, and just as a check-in. And that's missed, as I'm sure you know.
Yeah.
And so having this opportunity to just connect with you again, it's like a whole mini reunion.
Thank you.
And so if you can see the president of Mount Sinai West is stating that we miss you. Yeah. Clearly.
Dr. Flato can tell you he spent some time in Trinidad too. Wait till you hear his Trini accent.
Well, so because next month is Caribbean, I think it's Caribbean American Month or Caribbean Heritage Month.
Yeah.
Sounds like we have to have you and Dr. Flato on.
Well, I have to have
another conversation.
Talk to you about Caribbean music and other things that you would be surprised that he knows about.
Oh, well, so much about our
we really are. When you say dropping the gems, we're continuous here. But thank you to everyone who also attended. Thank you for the amazing questions. Thank you for the amazing engagement. We couldn't be more excited to share this time with you, to share this moment with you. Thank you to ODI for having us use their Zoom and just being able to use their platform. Thank you again to Dr. Flato for partnering and supporting us. When I spoke to him about this event, I couldn't even finish the question out of my mouth before he said, "That sounds amazing, do it." And it was like, oh, okay. So thank you to him and the ODI team that we have here, just for the encouraging support. And again, to just Ashley's point, if you are interested in obtaining the COVID-19 vaccine, please be sure to speak to your EHS or to someone, your ambulatory care, whoever has a pod at your site for more information and the potential vaccination. And we just want to say thank you again for spending this time with us. Ashley?
Yes, Wendy, thank you so much. I really do look up to you. It was great seeing you in the halls at West, hearing your laugh in the cafeteria. And when I first started and I heard you laughing in the cafeteria, interacting with other people, it really made me feel comfortable as a young Black woman and a new employee. So I knew from then that you had a very good place in my heart. So I thank you again for taking the time out of your busy schedule to have a conversation with us, to educate us, and to allow us to love ourselves a little bit more and just to be our best selves in everything that we do. So thank you so much.
Thank you, lady. Thank you for the opportunity, and thank you to all of the leadership that enabled us to have this opportunity to share with others. It's been just a wonderful experience, and I hope to always see my friends and family from West and throughout the system. So great opportunity. Thank you.
Thank you again. So much, and everyone, thanks again for spending your hour with us. Have a wonderful Thursday.
Okay.
Bye-bye.
Bye-bye.